This is Columbia Morning on News Talk 1400 KFRU. May is here, and we're 3 days into it. Before we know it, we'll be into the summer months. And so we're going to talk about an event that comes up on May 23rd. It's sponsored by MU Healthcare. Melanoma Awareness Month is this month, and we have the privilege of talking to Dr. Emily Smith, who is here to tell us some things that we need to know about this as we enter into the time where we expose more skin to the sun. It's good to see you. How are you?
Very good. Thanks for having me this morning.
You said off the air that it's a busy time, so things are busy because of schedules of people in school and wrapping up school, getting ready for summer. What do you need to keep in mind, or what do you want us to keep in mind as we're approaching this time?
Well, this is the time of year to start getting your sun protection game in order. So start thinking about what you're going to do as you're increasing your outdoor time. Lots of ways to protect your skin from the sun. Sunscreen is one of them, but protective clothing can be very, very useful and sometimes easier also.
So we kind of like, though, to shed the layers that we've had during the winter. And this winter was one where it seemed like, it just seemed like the winter that went on for a long time. Now it feels liberating to not have to have some of the things that we had to have during those cold months.
Yes. So if you want to be out there completely free, wearing your your summer gear, then sunscreen's really the way to go and protect that exposed skin.
What do you say as far as sunscreen is concerned? This is a message that I think a lot of people hear, but I don't think we process it all the time, because what we do is we hear it and say, I've already heard this, and so we block it out, and then we don't remember anything.
Yeah. Sunscreen is tough to do, but if you make it part of your daily routine, then it just becomes like brushing your teeth. So one of the easiest things to do is, and get your facial moisturizer that you're putting on your face every morning. Just make sure it has sunscreen in it. SPF 30 is the goal. But if you get that on your face, you can maybe get it on your neck, the backs of your hands. If you're doing that every morning, you'll buy yourself a lot of benefit.
So let's say that I do keep longer sleeves on. Do I still have to protect the back of my hands?
Yes.
Aren't they tough enough to take these kinds of things?
They're not tough enough. No, the backs of our hands still get a lot of sun exposure. Even when we're driving in the car, the sunlight that comes through the window glass can contribute to signs of aging for sure, but also to skin cancer.
So what areas of the body do you see, and do you know other doctors who specialize in skin cancer? Where are we most prone to see skin cancers?
Well, there's sort of two different scenarios. So the skin on our body, like our face and the backs of our hands and the sides of our neck that get sort of long-term exposure year-round, those spots are certainly at risk for developing skin cancer. But the parts of our body that are intermittently exposed to sun, so the parts of our body that are, pale most of the year, but then get burnt or tan in the summer months, are at high risk also. So the backs of men and the legs of women.
Would you say something to people who know people, or they themselves think that tanning beds are okay?
They are absolutely not okay. They are a known cause of cancer. And so there is, under no circumstances are they safe to use.
And you can't, what's the opposite of weaning off something? Would be introducing yourself to something to get you ready for sun. In other words, you can't say, well, I'll spend 5 minutes today, 10 minutes tomorrow, 30 minutes next week, hardening my skin for what's coming maybe in June, July, and August.
Yeah, having a tan, getting that base tan is not safe. So when your skin is tan, it's a sign that your skin has acquired damage. And the tan is that's your skin's response to protect itself. So as long as your skin is staying tan, that means it is experiencing damage from the sun. And so no tan is safe.
I understand, but that is a hard message. Are we
is.
getting any better at changing what would be social mores that favor tans? Are we getting better in saying that person without the tan looks healthier?
I really think that has started to shift, that the culture has started to shift, and I'm really excited about that. But yes, I think that tanning beds are coming less popular, which is very important because they have been correlated with an increased risk of, or an increase in the number of cases of melanoma, which is a very serious type of skin cancer that we are seeing, especially in young women. But I see more and more people embracing either fair, pale skin, skin in its natural state, or the spray tans and the spray lotions. Those are safe, much, much, much safer than a tanning bed.
So chastise me for a moment here, because I just don't worry about it.
Yeah, and it's hard, really, especially if you're not one that burns when you go out. There is no immediate consequence for you. And so all I can say is do your very best. We definitely want everyone outdoors enjoying the activities they enjoy, but think about the sun that your skin is getting while you're out there. And if it's a hat or sunscreen, whatever you can do to decrease the amount of sun that your skin is exposed to will be helpful.
I'm not looking for a tan. I'm not looking, I don't lay out. I don't seek to expose myself to that. It's just that you just go out and you mow and you do recreational activities and you just let it happen.
It happens, yeah.
I said you don't have to have the headphones, but hold it up because I'll see whether this is a question or a comment. Dr. Smith is our guest in MU Healthcare. We're talking about skin cancer and melanoma month is May. Caller, did you have a question or comment?
Oh, are you talking to me?
I am.
Yes, she's not on the target. The target is you labor in the sun, idle in the shade, never lay in the sun. You have to have movement going on. Start out in April. Now, this April was cool, but normal April, you start your light tan when the sun is cool.
All right. I appreciate the call. I do like that, though, labor in the sun and rest in the shade or lay out in the shade. I mean, that would make sense to those of us who feel like you need to be more practical when you're outside. But
absolutely. Some
people, I mean, they really do seek that tan. And
yes.
it's I don't get it.
Yeah, seeking the tan is certainly a much higher risk behavior. But those who work outdoors and do labor in the sun, who have careers outdoors, are at a significantly increased risk for skin cancers as well. And so just being conscious of that. And if you can wear the protective clothing that actually does keep you cooler, it really does. It wicks away sweat, or keep sunscreen on that exposed skin, it will be beneficial for you in the long run.
How prevalent is skin cancer?
It is the most common cancer in the United States. 1 in 5 Americans make a skin cancer. So this is a major, major problem, and it is a preventable problem, something that no one has to go through.
So could it be even as small as like the tips of your ears?
Absolutely. That's a very common spot for us to see skin cancers.
I think that's the last place I got burned.
Yes.
Probably on the tips of my ears. Well, let's talk about the skin cancer screening, which is May 23rd. What is that?
It is. So we are offering free skin screenings to the general public. You're welcome to come in and see us. If you have a spot you're worried about, we'll take a look. Otherwise, we'll look at your exposed skin, whatever you would like us to see. You'll be in a private room. You'll see a dermatologist through MU Healthcare. And if we find something that is concerning or needs further attention, we'll make sure to fast track you into one of our clinics and get it taken care of.
What are the hours for this?
So 3 to 6 p.m. on May 23rd at Ellis Fischel Cancer Center. And we do encourage reservations. And so if you're interested, we can have you call Ellis Fischel at 573-882-5755. But if you show up, we'll make sure that we see you no matter what.
That's 882-5755?
Correct.
And that's Ellis Fischel, and that's if you'd like to be put on the calendar for a time to be screened for skin cancer on May 23rd, which is a Thursday, if I remember right.
That is correct, yes.
I'll have to be very careful because I think I'll be in Kingsville, Texas on that day. Outdoors all day at a track meet where usually is where
you'll be getting a lot of UV rays
sun.
that
so
day.
We'll get a lot of sun. I should wear a hat to cover as much as I could there, and light colors and cool clothes.
Yes.
Okay.
That cover all of your skin as best you can.
Anything else you want to tell us about this?
No, but everyone just pay attention to your skin. If you've got a spot that won't heal or a spot that's changing or anything you're worried about, have it checked out.
So a spot that would be like itchy or a sore, open sore, those are kinds of indicators?
Open sores, like things that look like pimples that aren't healing, that can certainly be an indicator. Or a spot that is changing, any kind of changing. It's growing, itching, bleeding, changing color, changing shape. Never hurts to get those checked out because skin cancer is curable when caught early.
What's the difference between an age spot and a skin cancer spot?
Sometimes it can be tough to tell the difference, but age spots are usually just little flat brown spots that we make with time.
I've
call
got
them
plenty of those
wisdom spots instead of age
wisdom
spots.
Well,
we have lots of cute names for them.
Yeah, well,
but they usually stay kind of stable in size and shape, and they look similar to the other spots on your body. But if you have something that looks like an ugly duckling and doesn't look like anything else on the rest of your body, that might be a sign it should be checked out.
Caller, real quick, if you have a question or comment on the topic. Hi.
Just want to say that you listen to this doctor. She has eagle eyes, and she is incredible.
Oh.
She has helped me out so much.
Oh,
I
good.
appreciate her.
I'm glad you
Aw,
called. Thank
thanks
you.
for calling.
So you might recognize that voice. You may not, but there you go.
That
you got
voice
eagle
did
eyes.
sound familiar.
What does Cancer Ninja mean? The little thing that you got up there.
Oh,
on
it
your
means
neck?
we're just seeking it out and taking care of it, one cancer at a time.
All right. So call and get a reservation if you want to take part in the free skin cancer screening event at Ellis Fischel Cancer Center, and that's on May 23rd. That is 3 weeks from yesterday, actually. And the phone number to get a spot, 882-5755. Dr. Emily Smith, thank you.
Thank you for having me.
It's News Talk 1400 KFRU. We get ready to go to the newsroom after this.